Welcome to Let's Talk Climate. I'm Rebecca Rear, Director of the Climate for Health program at ecoAmerica. And while we're all tuning in virtually, I am hosting this episode from just outside of Washington, D.C., on lands shepherded by the Nacotchtank and Piscataway people. I'm looking forward to today's topic, welcoming 2022 with climate optimism, with our guests, Dr. Cecilia Sorensen, Director of the Global Consortium on Climate and Health Education at Columbia University. Hi, Cecilia.
Hi, Rebecca.
And Dr. Jay Lemery, Associate Professor of Emergency Medicine and Co-Director of the Climate and Health Program at the University of Colorado School of Medicine. Hi, Jay.
Hey, Rebecca. Hey,
Thanks
Cece.
so much. Thanks so much for being here today. So together, you founded and are facilitating a Climate and Health Science Policy Fellowship, which is supporting physicians who want to build climate and health into their practice. Could you start by telling us just a little bit about that fellowship and how working with folks in the program has given you hope or optimism? So Jay, why don't we start with you?
Yeah, thanks. So the fellowship is really a goal to create credible, knowledgeable, effective leaders, clinician leaders in climate and health science policy. And, the real facets of them are to get our fellows into places where the policy is actually happening. So we have them embedded with 5 federal agencies in DC, as well as nonprofits like the group that Cece works with at Columbia and ecoAmerica as well.
Yeah, Cecilia.
Yeah, it's such an exciting fellowship. I like to say I was the first fellow. I was the prototype fellow 3 years ago, and it's such an incredible opportunity to really bridge the health community with the climate community. And I think that's really been a push, at least on the national level and the global level, to really have more synergy and more integration between these different communities. And so what we find with our fellows is that, they're all clinicians, right? They come to it with a really strong clinical background and a strong interest and passion in climate, but we're embedding them, for example, within NOAA, within the US Global Change Research Program, within NIH, and these incredible federal agencies where they don't necessarily have the strongest health voice, but they want to. And so I think we're really filling a need as we're doing this incredible education. So I feel like the purpose of this is really kind of almost twofold. I don't know if you'd agree with that, Jay.
There's so many opportunities coming down the pike, right? Whether it's decarbonization of healthcare systems or healthcare system resiliency or training programs. And what we want to do is to create clinical leaders who can go head to head with a CEO, with an executive director, with a policymaker, and really weave together all the the many complexities that we know exist in climate and health, and be able to speak forcefully about the importance of putting that patient first. That the primacy of the patient is really important. And so that's really what we want to do is to again have clinicians who are really well versed in all the different complexities of climate and health policy. No one's been trained to do this. No clinicians right now can raise their hand and say, I'm the person that can do it, because we don't have that training. So this is really an effort to do that. So it's an intense effort. I mean, it's 5 fellows a year, and we're hoping to scale that out in different ways, where to create a diploma program or even certification programs that are less intense, so people or clinicians can have those opportunities. But really, the goal of this again is to be able to have a seat at the table and really, be effective leaders.
Yeah, and I would add.
Go ahead.
No, I would add, one of the things that's so cool about the fellowship is that we have clinicians coming from all different backgrounds. We have family medicine physicians, internal medicine, emergency medicine, and so on. And so, then they become leaders within their fields of medicine. And additionally, our fellows come with all their passion to do different activities. For example, be leaders in education, be leaders in research, be leaders in policy. And because of the framework of our fellowship, they're able to explore and really nurture their own interests. And then as a result of that, we have leaders in multiple different fields of climate medicine, which is really neat to see where our fellows end up.
We know this is an all hands on deck crisis, right? And so we started off training emergency physicians. That's just how we were able to administer it. Now, next year, we have a neurologist, we have a neurosurgeon joining the fray, which is really awesome. And they have brought a whole new background to the table, which is like thinking about cardiovascular risk and plant-based diets and liaising with groups like CMS to think about how hospitals can really be change agents, through food services, right? And that's just something that we have never really focused on. So those perspectives are invaluable, and it really makes this all medicine, all house of medicine endeavor, as opposed to what historically started off, in emergency medicine. So we're learning from them and the different perspectives that they bring to create, again, what can, what's a 360 we can do within the house of medicine in terms of training and this fellowship.
Yeah, and it really does sound like they're giving you hope and optimism, like that sort of training and being a part of development of sort of the future of the clinical workforce, particularly in the face of a changing climate, is something that can give us hope. And I think that's what a lot of people look for hope and inspiration now, because a lot of what we see in the news or what we see, dominating headlines is so doom and gloom, and we need to focus on these really important efforts that are happening all over. And we are, we're lucky at Climate for Health to host several like rotating fellows, is what I refer to them as. They've done some great work. We have great blogs from their perspectives. We actually recorded a Let's Talk Climate episode. They've become Climate for Health ambassadors as well, taking our training and sort of working with their peers beyond the fellowship. And what we hear so often in climate and health is that by the time someone comes to whether it's the ER or a regular checkup, when they're presenting with symptoms that are either caused or exacerbated by climate change, what interventions could have happened at the systems level or at the just at the prevention level before they come to present with these symptoms that could help. And I think it just sounds like this fellowship helps clinicians who are more involved in the point of care think about that upstream approach as well.
Yeah, that's exactly right. When we started this, it started off as a School of Medicine program, and we really wanted to articulate, how is this different than a public health approach? Of course, there's a lot of integration there, but really, we said, if you touch a patient, what does that perspective look like? What is that patient-centric thing that the clinician has? And we knew that there was it was really important to mobilize this constituency, because the conspicuous absence of clinicians for decades on this topic, and then really you think about what is different than thinking about the public health perspective, which is 100,000 million people, to that individual patient. How is that different? And so that was really the niche that we thought we could fulfill, and have built it out from there.
Yeah, and Jay, I wanted to ask you, actually, I know you're in Colorado, which recently saw devastating fires. So just tell us a little bit about what was that experience like for you and your community, and how, as a health professional, are you supporting action to both support local recovery, but also to prevent future disasters?
Yeah, the ferocity of that fire and the rapidity of it and the total destruction was something I don't know that anyone's ever seen before in a place that we didn't expect it, right? So it was again, it was just a fire breathing dragon that came through. I think over 900 homes were destroyed. A lot of people that work in our hospital system live there, and so those were real victims. Luckily, there wasn't a lot of people that were injured, but again, so our hospital system has really taken a footing where, who needs help, who needs shelter, who needs work shift support. And then for those of us on the larger perspective of climate health, it's explaining, what happened, how climate has contributed to this. The best thing I can think of is going back to our friend Catherine Hayhoe. This is a perfect example of global weirding, right? We just didn't see this coming. And I think if nothing else, it was a place that it really shook people up, because we're like, this was never something we thought could happen in this particular geographic setting of that community. It wasn't necessarily in a remote mountain valley full of trees, right? It was on the plains. It was a suburban area. So, but but I think, you know, like many disasters happen, the community response really gives people hope, and I think it's been quite robust. It's a strong community. You know, the hospital system is very much integrated, and so I think there's a lot of hope there. But I do think the flip side of that is a big WTF. What just happened? What does this mean? Is this climate driven? Is this global weirding? And you know, I think there's a good chunk of PTSD that will need to be processed from this.
Yeah, it's so important that you just bring up the mental health component, and that we're seeing more and more the mental health impacts of climate change, but also the resources that are available and then needed to address the mental health impacts of climate change. But you also mentioned something earlier about no one expected it here. And that's a theme I feel like that we hear. It's like, oh, I've seen that happen elsewhere. I didn't expect it to happen here. And, you know, there's that's sort of why we all need to care, right? It's like, because it is happening in more places. It could be, you know, and that's not, you shouldn't take that as a reason to build anxiety, but more about a reason to be prepared, and that we have the tools and resources that you can prepare, and there's better and better attribution science and better predicting where this will happen. And I think, I hope people are listening and thinking, right, it could happen, and here's how I'm going to prepare, and here are the tools and resources to do that.
Yeah, a lot of our messaging, right, is trying to make climate change relevant to everybody. And so, you know, oh, it's a tropical hurricane in Florida. You know, I live in Colorado. I don't have to worry about that, right? So it's trying to create examples and messaging to say, this is a global issue, and it's going to affect everybody.
Yeah, for sure. And speaking of global, Cecilia, you direct a global consortium on climate and health education. So I'm wondering, you know, how has the U.S. played a role in health when it comes to global climate dialogues? So, you know, we had the recent COP26 in Scotland, for example. And what progress has the health community made in this discussion, and sort of your advice for health professionals to raise awareness on climate and health impacts and solutions?
Yeah, that's a great question, Rebecca. I mean, you know, I feel like, well, I think that, you know, the COP26 was, although overall did not meet the aspirations that the climate community has in terms of commitments to keep warming under 1.5 degrees Celsius, there was this huge mobilization of the health community and of the US health sector within the COP. So, you know, the health sector has been a little bit of a late comer to the climate conversations at the COP. However, this year was the first year where the World Health Organization had their own pavilion within the larger larger meeting. And so it was really this sort of nexus where all these different folks who are interested in climate, working on climate from a global perspective, could really come together. And so for me, that was incredibly invigorating, just to see that there's people all over the world working on this. And that for me gives me so much hope. Also, it was incredible that the US was actually there, and that they actually had an incredible health program. We had Office of Climate and Health Equity, giving multiple day sessions, talking about climate change, talking about health, and really saying, you know, we're back, we care, this matters. On a global level, I think there's been a lot more mobilization, a lot more cooperation. So for example, leading up to the COP26, there were hundreds of organizations which signed the Healthy Climate Prescription Letter. This was a letter that was written to decision makers globally saying, you know, we really need to take the steps now to limit warming below 1.5 degrees Celsius and to strengthen our healthcare systems. Many organizations based in the US were part of this initiative, which led this initiative and signed on to it. So I think there's just like an incredibly robust movement happening from the US that's being part of these larger global dialogues. In addition to that, you know, the Global Climate and Health Alliance did this incredible dissection of all the existing NDCs for different countries and said, okay, here's the ones that have health, here's the ones that don't. So that really helped the health community dial in their advocacy, dial in their dialogues with different countries to really be able to say, you know, there isn't health here, here's how there could be, and to really make that case. I think one of the biggest outcomes of the COP26 was the fact that over 50 countries signed the COP26 health program, which was really based around this commitment to develop climate resilient and low carbon health systems. And the United States signed this, and we're one of the biggest emitters. And so I think, showing our leadership in these global efforts is really an incredible way to see the US take the stage. So I feel optimistic coming out of it. I don't think we're getting everything we want. We're not where we need to be. But I never saw this happening. I think there's tipping points and there's watershed moments for our movement. But I think we're making steps. We're making steps, and I feel it. So I'm optimistic.
Yeah, maybe not at the tipping point yet, but certainly tipping the scale a little bit, right?
Yeah, exactly. Exactly. And I would add, from where I sit at the Global Consortium, I see optimism every day. There is this huge groundswell right now happening among health students, among institutions and universities. So we are based at Columbia, but we're really a global organization, and we have over 250 health professional schools who have pledged at the highest levels of their organization to train their health professionals in climate and health mitigation and adaptation. And so we think we're reaching about 150 to 175,000 students every year who are getting training in this. And we're talking about clinicians, we're talking about nurses who are incredibly powerful communicators and advocates. We even have representation from social work programs, from physical medicine and rehab programs, and especially pharmacy, which is making a huge presence in the global arena. I think, one of the things that we are really focused on this year is looking at that interprofessional intersection, right? Because it takes a village to really make a community and make a health system resilient, right? And we all need to be on the same page. And so, our main focus right now is really thinking about that interprofessional space and what dialogues do we need to have with each other, and how can we work together to really increase the mobilization at our national levels, at our national levels, and at the international levels.
Yeah, no, that's fantastic. And I think especially just to reiterate how important it is to see federal leadership from the US very visible on this issue in a way that maybe we haven't seen in a little while. And so just, but I would say, I would encourage everyone listening, particularly if you are a health professional, sign the healthy prescription. I think you still can. We'll see. We'll put a link in the chat I think so. Note if you can. But if, and because I would say, especially because we have a supportive administration for this work, it's not a time to sit back and clap your hands and say, congratulations. It's a time to roll up your sleeves and say, and here's how I want to see it implemented. And this is important to me. And so you can call your elected officials and let them know, hey, it's great to see the US leading on climate and health, especially. This issue is important. Keep it up, put the dollars behind it. And, and then people need to hear that. To keep that progress moving forward. And so I would just encourage everybody to, put that call in. And your voice as a health professional really matters in this topic, and that your representatives at every level need to hear from you on this. And so just you've both mentioned communication, and we do know that people personally care about climate change, but very few people actually talk about climate on a regular basis. And so I just want to know, what's your favorite climate conversation starter? If you're like me, you probably do talk about it quite a bit with, not just at work, but with friends and family, and, and sort of at parties when we used to go to them in person. But what is your favorite climate conversation starter, and how can we reach everyone every day on climate change? Jay, why don't we start with you?
Yeah, right now we talk about I have a lot of family in the Northeast, so I'm talking to them about the crazy weather variations. And then, they're like, man, it's hot today, or it was raining, or there's a crazy cold front, so it gives an opportunity to say, well, yeah, it's, the weather patterns are really changing. What do you think's going on? That gets people invested, because then they can, it's part of what's happening in their community. And then, it gives an opportunity for us to talk about, like, what are you working on, Jay? I'm like, well, here's what we're doing. Here's why I think it's important. And here's why, we think healthcare providers really need to lead the charge on this because of all these, all these other reasons. And so that allows, I think, allows people to feel invested in it's a tangible way of connecting on shared values, which, we know from our communication specialists, so it's really important to do that. And again, I think, we're still trusted messengers. We know nurses are the best, physicians are right there too, where we can, have that common ground where it doesn't elicit, unfortunately, that political thing like, whoa, you're talking about politics. No, we're not. We're talking about, health and science and, our communities and shared values. So yeah, I think that's a easy way to kind of lead in, because the weather is just right. It every month there's something to talk about.
Yeah, Cecilia.
Yeah, absolutely. I mean, I think, as Jay mentioned, there's always something, right? And even like when you're sitting next to someone on the plane and they're like, wow, it's hot, or, oh, wow, there's wildfires. I sort of like, I wonder if it's linked to climate. I sort of ask the question because I think when people sort of then think it through with you rather than, telling them it's climate, I think I try to sort of take this step back. Like, I wonder if this is related to climate change. And it usually leads to a more interesting conversation, and you sort of see where people are at with it. I think there's an incredible amount of energy going into this right now. I wanted to bring up another source of optimism, which is the National Academy of Medicine Grand Challenge on Health System Decarbonization, where they have a working group, which Jay and I are actually both on, around communication and education, where really we're focused on thinking about how we can empower health workers and learners to better advocate for decarbonizing healthcare and building resilient health systems. There's a lot of energy happening and investment at the national level on this. And so I think it's going to be really interesting to see what comes out of this in the coming months.
Yeah, for sure. And I really appreciate you leaving us with another note of optimism and another really tangible action that's happening now from a well-respected and known entity such as the National Academy of Medicine. So thank you for serving on that working group and being a part of that movement, and making sure that, things are that we're seeing this momentum. We've reached the end of our time today. If you can believe it, I've really enjoyed this conversation, and it's certainly, I'm excited about what this year is going to bring for climate action, and I'm excited to see the health sector really stepping up. And I think you've included for our listeners many tangible ways to get engaged, and certainly left us with notes of inspiration and action. So, we're at the time, while we're at the end of our time today, we're certainly not the end of our optimism or actions. And so I know you've inspired our listeners to be bold and prioritize climate solutions to improve our health and our family's health. So just Jay and Cece, thank you so much for joining us as our guests. We are grateful for everything you shared here and for your ongoing work to act on climate. For everyone listening, check out the description below to let us know what you think. Engage with us online with the hashtag Let's Talk Climate, and be sure to subscribe and follow us for the latest thought leadership, resources, and episodes on climate action and advocacy. From all of us at ecoAmerica and Climate for Health, thank you. Please join me in caring for our climate in order to care for our health. Stay well, stay safe, and get active. Thank you.
Thanks, guys.
Thanks.